Your doctor smiles. 118 over 72. Perfect. But what if that perfect number is the reason you felt dizzy last winter? What if it explains why your mornings feel foggy, slow, unclear? Here's the uncomfortable truth. For someone in their 70s, that number may not be ideal at all. In fact, it could be doing the opposite of what you've been told your whole life. For decades, we've been taught one rule: lower blood pressure is always better. But new research is telling a different story, a story most people never hear. The target you've been chasing, 120 over 80, may not be built for your body anymore. And today, you're going to understand why. Because this isn't just about numbers. It's about how your body actually works. After 60, after 70, and beyond. So, where did 120 over 80 come from? Most people assume it's the result of decades of research on older adults, carefully tracked patients, long-term studies, a number built specifically for people in their 60 seconds, 70 seconds, and beyond. But that assumption is wrong. This standard was largely based on studies of middle-aged adults, people in their 40 seconds and 50 seconds, healthier arteries, more flexible blood vessels, faster physiological responses. For them, lower pressure made perfect sense. The problem is what happened next. Medicine took that number and applied it to everyone. Same target, same expectation. No matter the age, it became a universal rule, rarely questioned. But here's the issue. Using 120 over 80 for a 75-year-old is like using a ruler, designed for a completely different body. And when the tool is wrong, the result can be misleading or even dangerous. After the age of 60, your body begins to change, whether you notice it or not. Your arteries slowly lose their flexibility. They become stiffer. Imagine a brand new garden hose. Soft, elastic, easy to bend. Now compare that to one left in the sun for years. It's rigid. It resists movement. That's what happens inside your body. And when your arteries stiffen, your heart must push harder just to keep blood moving forward. This naturally raises your blood pressure, not because something is wrong, but because your body is adapting. This is biology, not disease. But there's another change that matters even more. Inside your blood vessels, you have tiny pressure sensors. They constantly monitor blood flow. In younger bodies, they react instantly. You stand up. They adjust in seconds. Blood keeps flowing to your brain smoothly. But after 70, those sensors slow down. The response is delayed. So if your blood pressure is already too low, there's no safety buffer left. You stand up. Gravity pulls blood downward, and your brain doesn't get enough supply. For a few critical seconds. That moment may feel small, but in an older body, it can be the difference between stability and a dangerous fall. Let me ask you something. Have you ever stood up too quickly and felt a sudden wave of dizziness? Maybe you paused for a second, grabbed a wall, or held on to something nearby, just to steady yourself. It passes quickly, so you ignore it. You tell yourself, that's just part of getting older. But what if it's not? What if that moment is your body trying to warn you? A signal that your blood pressure might actually be too low for your brain to function properly. If this has happened to you, even once, pay close attention to what comes next, because this could explain more than just dizziness. In 2019, a major study was published in the Journal of the American Medical Association. This wasn't theory. It wasn't based on younger adults. It focused specifically on people over the age of 75. Real patients, real data, tracked over time. And what the researchers found was something most doctors never explain clearly. For this age group, the optimal systolic blood pressure was not 120. It was higher, between 130 and 145. Let that sink in for a moment. People in that range had better outcomes, fewer hospital visits, better cognitive function, lower overall risk of death, not lower, higher. This challenges everything we've been told. Because if 120 isn't ideal for older adults, then pushing everyone toward that number may not be helping at all. In some cases, it may be quietly making things worse. Now, let's be clear about one thing. High blood pressure is still dangerous. If your numbers are above 160, 170, that's a real risk. We're not ignoring that. But there's another side most people never hear about. Blood pressure that is too low can also be dangerous, especially in older adults, because their bodies don't respond the same way anymore. When pressure drops too far, the brain doesn't get enough blood. Balance becomes unstable. Energy drops. Thinking slows down. And yet, millions of people are being treated as if lower is always better. This creates a hidden problem. People are taking medication to protect their heart, but unknowingly entering a range that may put them at risk. This is what experts call over-medication. And it's far more common than most people realize. Here's the number that stopped many experts in their tracks. Older adults over 75 who are treated aggressively to reach below 120 have a 28% higher risk of serious falls and fractures. 28%. That's not a small difference. That's the kind of risk that changes lives overnight. Because at this age, a fall is not just a fall. It can mean a broken hip, a head injury, weeks or months in a hospital. And for many people, it's the beginning of a rapid physical decline, all triggered by a number that was supposed to protect them. Now here's the cruel irony. Doctors prescribe medication to protect your heart, to prevent strokes. A good intention, a necessary goal. But when that medication pushes your blood pressure too low, it creates a different kind of danger. The risk of falling increases. And a fall at this age can trigger the very problems the medication was meant to prevent. Heart complications, brain injury, loss of independence. So the treatment, designed to protect you, can quietly become the thing that puts you at risk. Let's look at what's really happening inside your body. Your brain is the most demanding organ you have. It makes up only about 2% of your body weight, but it consumes around 20% of your blood supply, constantly, every single minute. It depends on a steady flow. When that flow drops, even slightly, your brain reacts immediately. In younger people, this isn't a problem. Their bodies adjust fast. Blood flow is restored, almost instantly. But in older adults, that response is slower, and that delay changes everything. If your resting blood pressure is already low, there's no reserve left. You stand up, blood shifts downward, and your brain doesn't get what it needs. For several seconds, you may not faint, but you feel it. Dizziness, darkened vision, a brief loss of balance. It passes quickly, so most people ignore it. But that moment matters, because in an older body, those few seconds can be the difference between feeling stable and losing control at exactly the wrong time. Now here's the part most people never hear. That brief drop in blood flow to your brain doesn't just happen once. It can happen every morning, every time you stand up, dozens of times a day. And over time, those small moments start to add up. Emerging research suggests that repeated low-level undersupply of blood to the brain may accelerate cognitive decline, not instantly, but slowly. Memory slips, slower thinking, loss of clarity. So when your numbers look perfect, you need to ask a different question. Does your mind feel perfect too? I want you to check something. Be honest with yourself. Do you feel dizzy when you stand up from a chair or get out of bed? Do your mornings feel heavier than they used to? Even after a full night of sleep, you still feel tired, slow, not fully alert? Have you noticed? Your thinking feels different? Words take longer to come. You lose your train of thought. Mid-sentence. Do your legs sometimes feel weak? For no clear reason? Or moments when you feel like you might faint, even if you don't? If you recognize two or more of these signs, don't dismiss them. They may not be just aging. They may be signals that your blood pressure is being pushed too low for your body to function properly. There's a medical term for this: iatrogenic hypotension. It sounds complicated, but the meaning is simple. The treatment is causing the problem. Patients report dizziness and are told it's aging. Fatigue gets blamed on sleep. Slower thinking gets labeled as early dementia. Sometimes those explanations are true, but not always. In many cases, the real cause is a medication dose that is too high for that specific body at that specific age. And this is missed far more often than it should be, because the numbers look good, but the patient does not feel good. And that difference is something you deserve to understand. Now, here's something you can do today, right at home. No special equipment, no complicated setup. It takes less than 5 minutes. It's called the orthostatic blood pressure test, and it can reveal more about your real condition than a quick check in a doctor's office. Here's how it works. First, lie down flat on your bed or sofa. Rest quietly for 5 full minutes. Then stand up mubasharat without sitting first. Within 1 minute, measure your blood pressure. Write the numbers down. Simple, but very powerful. Now compare your standing number to the one you had while lying down. That difference is what matters, because it shows how well your body responds to sudden changes. And for older adults, that response can mean everything. Here's what you need to look for. If your systolic pressure, the top number, drops by more than 20 points, when you stand up, that's a red flag. It means your body is not adjusting fast enough. That gap is the window where dizziness happens, where balance becomes unstable, and where the risk of falling increases dramatically. This is not something to ignore. It's something to take seriously. Let's talk about what the evidence suggests as safer ranges. If you are between 65 and 74, your systolic pressure should generally be between 130 and 140. Higher than 120, and intentionally so, because your body needs that extra pressure to function properly. If you are between 75 and 84, the range shifts upward. Around 135 to 145 is where outcomes tend to be better. Not lower, not aggressively reduced, but balanced for how your body works at that age. And if you are 85 or older, or more physically fragile, your optimal range may be closer to 140 to 150. These numbers are not dangerous. They are protective. But remember, this is not one size fits all. Your personal target should always be discussed with your doctor. Before your next doctor's visit, I want you to be prepared, not passive, not rushed, prepared. Start with this question. What is my personalized blood pressure target? Based on my age and my health history? Not just, is my number okay? Ask for a specific range and ask why. Second question, can we check my blood pressure, both lying down and standing? This simple test takes just a few minutes, but it can reveal whether your body is adjusting properly or struggling silently. And the third question, Could my symptoms, like dizziness, fatigue, or brain fog, be related to my medication dose? This question matters because it opens the door to a conversation most people never have. Let's come back to that number again, 28%. That's how much the risk of serious falls increases when blood pressure is pushed too low in older adults. This is not a small detail. It's a life-changing difference because one fall at this stage of life can mean surgery, hospitalization, loss of independence. This isn't about statistics anymore. It's about real people, real outcomes, and risks that can be prevented. After decades in medicine, here's what's most surprising. We focus heavily on the numbers, getting that reading down, hitting the target, and we call that success. But no one is measuring what happens outside the clinic at 6 a.m. when you stand up in the dark, when your brain doesn't get enough blood. For a few seconds, when you feel unsteady, but say nothing. That part rarely gets recorded. And yet, that's where the real risk lives. So the monitor shows a perfect number, but the patient feels worse, more tired, more foggy, less stable. This is the gap medicine needs to address. Because health is not just a number, it's how you actually feel every single day. So let's bring this together. What you've been told your whole life may not fully apply anymore. The 120/80 standard was never designed for bodies in their 70s seconds, 80 or beyond. Your body has changed. Your physiology has changed. And your targets should change with it. This isn't about ignoring your health. It's about understanding it at a deeper level. So here's your plan for this week. Step 1, do the simple test at home. Measure your blood pressure, lying down and standing. Step 2, book a doctor's appointment. Soon, bring your numbers. Bring your questions. Step 3, speak up because your health should not be based on assumptions or outdated rules. You are not being difficult by asking questions. You are being responsible. And in many cases, that one conversation, that one adjustment can change the next 5, 10, even 15 years of your life. That's not a small thing. That's everything. Now, I want to hear from you. Have you ever felt dizzy when standing up and assumed it was just age? Has your medication ever been adjusted and you felt better or worse? Share your experience below because your story might help someone else realize what's really going on. And if this helped you, share it. Send it to someone you care about, a parent, a sibling, a friend over 65, because this conversation is not happening enough, and it needs to. If you want to learn more about how your body changes with age, stay with me. Next, we're going to talk about another topic most people misunderstand: cholesterol after the age of 75. And once again, what you've been told may not be the full story. And one last thing, this information is based on research and clinical experience, but your situation is unique. Always use this as a starting point for a real conversation with your doctor